Hi, I'm Dr. Gabrielle Laing, and I'm the One Health Policy Advisor at Unlimit Health. Well, it's really a way of thinking about things that helps us to see the big picture, to think about human health and how it's interconnected with animal health or the environment around us. We deal with trying to control diseases such as schistosomiasis, which passes through the environment and a snail vector in order to infect people. So whilst we can treat people, and it's very important to keep on top of that and to continue those programs, we also want to move towards eliminating the disease and preventing people getting sick in the first place. So we want to be able to take that more comprehensive approach, recognising that we can work in other sectors and how we might all be interlinked and sometimes have shared objectives with other areas, so that we can work together to help deliver these programs and get that increased impact and better value for money. Now, recently, myself and our CEO, Dr. Wendy Harrison, were commissioners on the Lancet One Health Commission, and that report has been published. The vision of the commission was to try to leverage that One Health approach as being entirely necessary and viable to achieving equity, sustainability, and healthy socioecological systems. So the report published, it's quite long, but it sets out a cutting-edge appraisal of where One Health has come from and the development and evolution of that term, where we are now with it, and what a viable future could be. So in terms of the report's split into sections, and the first kind of 6 sections of the report analyse the growing scientific evidence base for taking a One Health approach. And that looks at with an emphasis on things like infectious diseases, and we've had recently the pandemic accord agreed to take a One Health approach, and that being crucial in delivering prevention, for example, of these diseases in the first place, for antimicrobial resistance as well, and for non-communicable diseases. We also looked at the added value, so sometimes taking a One Health approach where we work together with other sectors can demand more energy and more resources to start with. But where is that added value? Where is it worth applying those extra resources to get that increased synergy for the efficiency or effectiveness of what you're trying to achieve? And that might mean that we still need some areas for research that will allow those One Health approaches to fully kind of realise the insights that they can provide between those interconnections between humans, animals, plants and the environment in these very complex socio-ecological and health-related systems. And in section 8 of the report, we build on what has been a lot of recent political traction over the years, especially through the COVID-19 pandemic. And we propose 3 avenues for how we might operationalise, implement and institutionalise One Health approaches. And for those interested in the next steps, the Lancet Commission made 9 key recommendations. So just briefly, they cover institutionalising One Health in our governance structures, both nationally and globally. So making sure that our mechanisms of government are set up in a way that allow us to work together across sectors and to take on these issues as a bigger picture, complex system, rather than just having to be within a certain departmental mandate. And that means also that we want One Health considerations to be put into all policies. This helps to avoid some of the unintentional consequences that one policy can have in another area where there just hasn't been that thought about how it might be interlinked or interconnected with some other area. So thinking about policies not just in a separate silo, but across the whole remit of society. And these transformations, so working in that more One Health way, will be particularly key in food systems if we want to deliver sustainably and equitably the food and nutrition needs of people, but at the same time being able to promote health and well-being, not just among humans, but other animals, the plants and the environment at large. And in section 7, that presents a case study on food systems. Another big one, we recommended that global economics needs to change. For example, is GDP as a measure of success suitable for when we're looking at things like achieving equity, sustainability and well-being for all? And this transition to implement a more One Health way of working will need some innovative financing mechanisms to support it as well, because we need it to be able to function across sectors. And we also should be harnessing the potential of the private sector and what role they've got to play within this as well. And finally, we want to culture a One Health literate global society, and we can start right now with that, of course.